Hello, my name is John Wingeter with the Council on Aging of Buncombe County.
Hi, I'm Jacqueline Kiger with Pisgah Legal Services.
And we're here to tell you about the Affordable Care Act and the open enrollment period that's going to begin on November the 15th.
We know that a lot of people in our community have questions about the Affordable Care Act, how it affects you, and what information that you need to know. So we'd like to take a little time today to talk about some of those common questions and give you the information that you need so that you and your family can make informed decisions about the Affordable Care Act.
Question: what is the Affordable Care Act?
John, that's a good question. The Affordable Care Act is also known as health reform. It's called sometimes the ACA or Obamacare. All of those names are for the same law, the Affordable Care Act. Let's talk about how the Affordable Care Act affects people.
Well, Jackie, it affects people in a number of ways. One way is it is the law, and we are all required to have health insurance, or we may have to pay a penalty unless we have an exemption. And there are a number of ways that we can apply for an exemption. But basically, we're going to have health care coverage, or we may have a financial penalty when we file our income taxes.
Another important part of the ACA is that financial help is available that can help you with the cost of the premiums. And for some people, the financial help is also available to help you with the cost of using your health care coverage, like going to the doctor or having a lower deductible.
Well, Jackie, you said that the financial help is available, and it can be a little confusing. But it's also heartening to know that as navigator agencies, as Pisgah Legal Services and the Council on Aging, and several other agencies here in Buncombe County, we are available to help people go through the enrollment process. Question: how does the health insurance marketplace work?
That's a good question, John. The health insurance marketplace first of all, it's a website. It's a place where you can go to look for options for health insurance coverage. And that website is www.healthcare.gov. And when you go to the website, you have an opportunity to create an account and then look at the different options that are available, shop for health insurance, compare your plans side by side, so you can make apples to apples comparisons based on the level of coverage that you need and the type of plan that you're interested in. The bottom line is that there are affordable health coverage options that meet both your budget and your health care needs. If you don't have access to the website or a computer, enrollment assisters like Council on Aging of Buncombe County or Pisgah Legal Services have navigators that can help you through this process. There's also a toll-free phone number that you can call to access the federal marketplace. So you can call any time of day and apply over the phone for health insurance coverage. What's unique about the North Carolina health insurance marketplace is that it's the only place for you to apply for the financial help that's available. And so it's important that when you look at your options, you consider going to the marketplace if you need financial help to afford health care coverage.
So, Jackie, there are three ways that people can purchase health insurance. They can call the 800 number on the screen and enroll over the telephone. They can go to healthcare.gov and enroll over the internet. Or they can seek an appointment with Pisgah Legal Services or the Council on Aging and have a trained navigator guide them through the enrollment process.
Question, John. What type of financial help is available in the marketplace?
Well, Jackie, there are several types of financial help that are available. One of them is called the Advanced Premium Tax Credit. And the way that works is, depending on the household income, a person may receive an advance payment directly to the insurance company to help cover the cost of the premium. For example, what would happen if a person qualifies for an advance premium tax credit? Part of the premium is going to be paid directly by the federal government to the insurance company, and then the consumer will then pay the difference. Another form of financial help is cost-sharing reduction, whereby many of the deductibles and co-pays are reduced to help make the cost of health care even more affordable. You know, Jackie, some people may be confused as to how you qualify for advanced premium tax credit or cost sharing. Do you want to review for our audience what the income levels are in order to receive this assistance?
Sure. So what's on your screen now are the income levels for the different sizes and incomes for households who may be eligible for the advanced premium tax credit and the cost sharing reduction. To be eligible for the advanced premium tax credit, the income range is what's considered 100 to 400% of the federal poverty level. And so, for example, a household of one, that income ranges in 2014 from $11,670 up to $46,680. Another example would be a household of four. 100% of the federal poverty level starts at $23,850 and ranges all the way up to $95,400. So there's a pretty broad eligibility category for the tax credit. It's more narrow for the cost sharing reduction that you mentioned, John. That ranges from 100 to 250% of the federal poverty level. But we want people out there who are watching today to know that you don't have to figure this out on your own. Trained and certified navigators are available to help you determine who's in your household and what income level you fall at so that you can look at the various options that are available to you.
So Jackie, what happens if I have health insurance at work?
So John, it will depend. If you have health insurance at work, you most likely meet the requirement of having health insurance under the Affordable Care Act. Where it gets a little bit more complicated and tricky is whether or not you're eligible for the financial help that we have discussed previously, or if your family members might be eligible for financial help. So we recommend that people contact a navigator organization to learn more about their options.
So Jackie, we've heard a lot about these penalties. What are the penalties if somebody does not have health insurance?
Well, if you don't have health insurance and you don't qualify for an exemption from having health insurance, then you may be facing a penalty when you file your taxes. So let's start with the first year of open enrollment. When you file your taxes for the calendar year 2014, the penalties, if you don't have health insurance, are as follows and are as up on your screen. It's $95 per adult who is uninsured, half of that per child who is uninsured, or 1% of your taxable household income, whichever is greater. And that's really what we want to emphasize for folks. There's been a lot of coverage about the flat fee penalty, but the 1% of the household income, if that's greater, that's maybe what a family would have to pay. And that would be reduced from their refund when they file their taxes. Moving into 2015, you can see on the screen that the penalties increase greatly. It's $325 per adult who is uninsured, or 50% of that per child, or 2% of your taxable household income, whichever is greater. And then in 2016, the penalty increases even more. It goes up to $695 per uninsured adult, half of that per child, or 2.5% of household income, whichever is greater. Those are the penalties that people will face if they don't have health insurance. But what I do want to note is that there are caps on how much you would pay in those penalties. There's a cap on the flat fee penalty that I mentioned, but also when you talk about the percentage of income that you could be penalized, that will always be capped at a national level for a basic bronze plan, which the federal government will determine.
So basically, you would never be penalized more than the lowest cost of health insurance that's available to you, right, Jackie?
That's right, John. Question, John. What if I have Medicare?
Well, Jackie, that's a great question. If you have Medicare, a couple things. Number one, you've already met your individual responsibility here, and you don't need to purchase additional coverage. As long as you're covered under Part A of Medicare, you are fully compliant with the Affordable Care Act. You have to be careful because there are some groups out there that are trying to sell our senior citizens additional coverage that's totally unnecessary. So if somebody does tell you that you need to purchase additional insurance, even though you have Medicare, you need to hang up or tell them thank you, but no thanks. So Jackie, I already have health insurance. I bought it last year. Do I have to go through a re-enrollment process?
You do, John. And what we know is that pretty soon people are going to start receiving, or may have already received, re-enrollment notices in the mail. One notice will come from your insurance company, so either Blue Cross and Blue Shield or Coventry if you purchased health insurance through the North Carolina marketplace in 2014. And another notice will come from the marketplace itself, from the federal government. You will have in that notice information about an automated or automatic enrollment process, but what we and CMS, the Centers for Medicare and Medicaid Services, are telling folks is to come back to the marketplace, make sure that your information is completely up to date, and take a look at your options for 2015. Maybe you want to look at a different level of coverage or a different plan. Perhaps your income has changed, increased or decreased, and it will be very important for you to report that to the marketplace so that if you did get the advanced premium tax credit, that it is recalculated at the right amount of coverage for you. So the bottom line is that if you've gotten your re-enrollment notice, contact Pisgah Legal Services or Council on Aging to sit down with a navigator so that we can help you sort out what it means and what you need to do for re-enrollment for calendar year and health insurance in 2015.
So Jackie, what kind of changes does the Affordable Care Act provide to people?
Well, beginning in January of 2014, health insurance carriers can no longer deny people health insurance coverage for pre-existing conditions. That has been a big part of the healthcare reform under the Affordable Care Act. Also, health insurance carriers can no longer set limits, annual limits on healthcare coverage or lifetime limits on healthcare coverage for covered services under the plan for in-network providers. Now, there are some exceptions to these rules. Some people might be listening to this today and realize that, well, my plan still has a limit. There are what's considered grandfathered plans who still may fall under some of the old rules, but all of the qualified health plans that are offered through the North Carolina marketplace under the Affordable Care Act must adhere to the new regulations that we're discussing. There's also financial peace of mind that comes with knowing that there are affordable options that meet your needs and your budget. That way, people aren't staying awake at night worried about, well, what if I get sick or what if I have an accident?
So Jackie, what are the three things that everybody must know?
So, John, I think the three key things that people need to know about the Affordable Care Act is, number one, it's the law, and people have to have health insurance or they may be facing a penalty if they're not exempt. That number two, financial help is available, and that a broad and wide range of income levels can qualify for financial help. And that number three, open enrollment runs this year from November 15th, 2014 through February 15th of 2015, and that free expert assistance is available to help people understand and apply for health insurance coverage, and that they can reach our agencies, Council on Aging of Buncombe County and Pisgah Legal Services, by calling toll-free to 855-733-3711. We have a wide range of appointments available with certified navigators who will sit down with you in person, one-on-one, to help you understand what the ACA means for you and what your options are for health care coverage for 2015.
And another important aspect of that, Jackie, is the fact that as navigator agencies, we are unbiased. We do not represent any insurance company, nor are we selling any product. Our responsibility is to help the consumer understand what the process is, help them understand the health insurance benefits that are available to them, and guide them through the enrollment process.